Imade. Hey. So,
Hello.
My, oh my
Hey.
gosh, I love your hair.
Oh, thank you so much. I love your hair.
Thank you.
Yeah.
Hey. Oh my gosh, y'all making me jealous now. I'm like, I need Bantu knots. Dang it. I think Ashley from Black Girl in Ohm, she has them now too. And I'm like, dang it. I'm like,
Get
everybody's
into it. Get into it. Yeah, did you get okay, what are those? Are those faux
the
locks?
photo. Yeah.
Oh man, it's so cute. Oh, they look
Thank
so
you.
good.
I've had them for about 2 weeks now. So I
Okay.
like them. Like, every day they look better. So I'm like, okay, this is good.
Oh, that's a good look. That might be a introduction to getting them for real, if you
That's what
want
I
that.
said. That's what I said. That's what I said.
See how
So,
it
hey,
looks. Yeah.
everybody coming in. We're going to wait a few seconds to give people some time. If you know anything about Instagram, so Instagram Live will cut you off like mid-sentence. So, I'm going to try to give everybody like a few seconds. So, if you guys are here, just hang on for like maybe another minute and then we'll get started just to let some more people roll in. And everyone, just leave where you're from. Where are you watching from right now? You can talk about how your day was. If there's anything specific that you want us to touch on, you can go ahead and drop the comments below. If you don't feel comfortable, you are more than welcome to send us a message privately and we can respond to you afterwards. So do not feel any pressure to put anything in the comments that you do not want us to know. It's perfectly fine. So this is a mental health space, and so we honor everyone's level of transparency. Everyone is not where Imade and myself are. There are some things we don't even feel comfortable talking about, so keep that in mind. We are not here to pressure anyone. Add a few more seconds, and then we will get it started. Maybe had about 4 minutes. Trying to like make sure I got everything set up. I'm like, okay, laptop, good. Right, everything's set up. All right, so it's 7:05. We're gonna go ahead and get started. That gives us a good time. Okay, so hi everybody. Happy Sunday. Welcome to the Consciously Coping conversation with Depressed While Black. Today we are going to have a discussion surrounding mental health facilities and the Black experience. My name is Lindsay Anderson. I'm the founder and creator of Consciously Coping. Consciously Coping is a social media platform that has been created specifically for African Americans managing mental illnesses. And so how we use the platform is to uplift and amplify voices, because we know that sharing our stories is a radical movement. And it is one of the most powerful movements that we can do. Fight against the patriarchy, fight against the white supremacy. The more we share our stories, the more people we can help. And so myself, I'm a mom, I'm a student, and I am also a mental illness advocate. And I am also someone who manages 3 mental illnesses. Today, like I said, I have Imade from Depressed While Black. I have been following Imade. I don't even know how long. It's been a long time. I actually met Imade at the No More Martyrs Mental Health Summit about 4 or 5 years ago. She was on a panel with some other amazing mental health advocates. And everyone spoke out, said something that really spoke out to me, but Imade really kind of stood out above the crowd and just talked very passionately about her experience. And so I kind of just was like, I got to connect with her. And so ever since then, we've kind of been in connection. So I'm really excited to do this. I've always wanted to do something with Imade. So Imade is a writer. She is an author. She is a mental health advocate. She is amazing. She's wonderful. She is the founder and creator of Depressed While Black. Imade is currently in the process of getting Depressed While Black. There's a shirt. Getting Depressed While Black to be a 501c organization. So we are excited. So we have a lot to talk about. So I'm going to let Imade talk a little bit about herself and kind of a little more detail of what Depressed While Black is about, and then we'll get started. So go ahead, Imade.
Yeah. I'm a writer and a mental health advocate. I live with clinical depression and borderline personality disorder. Depressed While Black was literally just a way for me to graduate. I was at Columbia and I needed to write a thesis to get my MFA degree. And I didn't think I had anything to write about. But then I remembered, just the last year, I was driving on a Los Angeles highway wanting to die. And I was like, oh, this is something I need to talk about. And that thesis turned into an online community. And then now it turned into a nonprofit. I'm officially 501c3 now. So I'm really excited about that. Yeah, I can help more people that way. So yeah, Depressed While Black, it became a nonprofit. And what I do is I help create a mental hospital wish list program where local mental hospital patients give me their wish list of what they want me to donate. And so this is through the nurse at that hospital. And every month since January, I've donated Black-affirming personal care items like satin bonnets, wave caps, Y2 combs, things of that nature. And I partnered with Beam, which is another incredible mental health organization. I partnered with them to build a Black vision. That's our campaign. And through their organization, they are collecting donations for my program. So yeah, that's pretty much it.
Yeah, Beam is amazing. If you guys haven't a
Amazing.
chance, like, please, like, go stop by Beam. I mean, they do
Yes.
amazing work, and they've been doing it for a while. And just to see them kind of grow from where they were and just take over, they are, I mean, just awesome. I don't even know what it like. I have no words. Like, I'm speechless. They
They
are
are
amazing.
they are
Yeah,
like the best mental health organization like in the world. Like that's just how I
seriously.
feel. Like internationally, they're just I just feel like I see them on an international level, even though I know them
Yeah.
most international stuff.
Oh, yeah.
But yeah, so go to beam.community/Black Vision. It has our demands to defund the police and psychiatric jails and to invest in Black community mental health supports. It also has a link so you can donate so that I can purchase Black-affirming personal care items.
Good, good. All right, so let's get started. So the
Yeah.
first thing I wanted to talk about is something that you and I actually spoke about on
Mm-hmm.
your page
Yeah.
a few weeks ago. And so it's kind of a continuation of that conversation. And so for the people that are watching who may not have experienced a mental health facility, can you give us a description of what it's actually like to be a Black person inside of a mental health facility?
Yeah, I mean, it depends on the type of mental health facility you go to. If you're going to a punitive mental hospital facility that is restrictive, that inhibits your rights and your freedoms as a human being, you're going to have a much different experience than if you're at a place where you're being affirmed, your needs are being centered, and you're being heard. And so my first experience was at a punitive mental hospital, and what I noticed was that, it was like a plantation in some ways where the most marginalized people were Black folks. We were, physically restrained. I was physically restrained. We were placed in isolation rooms if we were non-compliant. Isolation rooms are essentially solitary confinement for a mental hospital. These rooms typically have no furniture. In the room that I got thrown into, it just had a thin mat on the floor, and it was a cement floor. And a lot of the times, Black patients are being chemically restrained, which means that they're being placed on harsh medicine that inhibits their ability to advocate for themselves. And what I noticed in this first mental hospital is that there was a young Black man, and he was arrested one of my first nights that I was there, and he literally was saying the same thing that I was saying. Like, I hate it here. I want to go home. The food sucks. I mean, I feel that way. I felt the same way. And he got arrested. I noticed Black women, particularly middle-aged, older Black women, were being chemically restrained, which meant that they were drooling on themselves. They were slurring their words. They were unable to advocate for better treatment. And there was one Black middle-aged woman who was permanently in the isolation room. Essentially, she was just always in there, and she was constantly drooling on herself. But she was cussing the nurses out the whole time, which speaks to the advocacy of Black patients. Even when we're being restrained, we're fighting. And I admire and honor the fight that she had. Yeah, and so it is a place that rewards being compliant over your wellness. And so when I got affected, deeply affected by the chaos of this atmosphere, and I just was like, you're making me worse. This is not a good place. This is not safe for me. Um, and they, they responded by, tackling me and throwing me to an isolation room. And these nurses who tackled me were not white. These were all Black, low paid workers, nurse techs. And so that's why I talk about, the plantation atmosphere, because Black people with the least power were at the bottom of this hierarchy. And the people that were making the decisions, the people that were in power, were white and non-Black doctors. They were the ones dictating what meds I'm on, how long I stay there, even though they only saw me for less than 5 minutes. The people who carried out these racist, oppressive policies were Black people. Unfortunately, they were Black people who were not given the power to advocate for themselves and advocate for patients. And what happened to me in particular in this hospital stay was that I would, publicly say, this isn't right, this isn't right. And the Black nurses would, punish me for that. But then after I got taken out the isolation room, the Black nurse who escalated my emotions and validated me would say, you know what, you were right. And, it makes sense that you responded that way. And it might have been good that you responded that way because you're a lot more calm now because you expressed it. And so you notice that these Black nurses can see that this is wrong, can acknowledge that it's not right, but they don't feel empowered to publicly validate how I'm feeling. And that's something that I noticed, during my first hospitalization.
It's interesting you brought that up. So many good things you hit on. I'm like, oh my gosh, I gotta remember all this stuff when I talk. But I wanted to kind of go back to the rights part of it, because I think a lot of people, for me, my experience. So if everyone who's watching, I've also experienced mental health facilities. I've been in and out of them since the age of 12. So I have seen them from the 90s up into the 2000s. And I had a very similar situation, very similar experience. I am naturally inquisitive. That's what I do. I ask a ton of questions. And I ask, what kind of medication will you be giving me?
Mm-hmm.
And it's necessary for me to ask because I need to know what this medication is, what it does, why am I taking it, how much am I taking, will I need to continue this? These are questions that anyone would ask if they went to a gynecology appointment or if they went to an oncologist. You ask these questions because this is something you are ingesting into your body. But to go back to what you said, it's almost as if you asking doesn't make sense to them. Like, you asking further validates oh, they're asking something's wrong, give them more medication, threaten them. So for me, I was threatened with, well, if you don't take it, you won't leave. And at that point, I lost my right. I was placed on Buspar. I had to take Ambien. Buspar makes me violently ill. I vomit horribly. And you are literally told to not move, take it, stand right here, and that's it. There is no type of conversation around, is there anything else? Is there something else that we can try? So I'm absolutely right there with you. So I think, Imade, something I was thinking about, just going into just the next conversation about defunding the police and as well as defunding psychiatric jails. I know there are going to be some people who say, but what about people who need medication? What about people who are a harm to themselves, who are a harm to other people? What do we do in those situations? So can you talk a little bit about what defunding psychiatric jails would look like? Or what does that even mean when you say that?
Yeah, it means removing money from things that don't work. I mean, why would we waste our money in services that kill people? People with untreated mental illness are 16 times as likely to be killed by the police, according to the Treatment Advocacy Center. Why are we funding murderers? I don't get it. Why are we funding crisis intervention programs that only cause more trauma and that exacerbate the symptoms that people already have? I mean, it just makes common sense, And then, what Beam and I are calling for is the investment of Black community mental health support that is proven to work. And I particularly, as a person with lived experience, I want peer support. I want patient-led services. That requires some therapists to lose their jobs. That requires, it requires, and that's controversial, because what I'm saying is that patients need to be the center of their treatment because they are the experts of their lived experience. And if you're not willing to put the patient at the center, you need to quit your job. And that's, I know that's controversial. I know that a lot of therapists are not there, but I feel like, trust me, you get much more investment when a client feels like they have a say on their treatment plan. And so what I'm hoping for when we talk about investing in Black community peer support is that we create peer support respite centers, like drop-in centers, where people like me who are chronically suicidal can, if we're having a really bad crisis moment, we can go to these centers and we can get the care that we need, and we can leave whenever we want, so that we're not afraid, if I check in, will I be able to go to my job on Monday? Because that's what a lot of people fear, is like, yeah, I need help, I'm really suicidal, but if I go into this mental hospital, I don't know when I'm getting out. And so it can look like peer support respite centers. It can look like the program that is in Eugene, Oregon, called Cahoots. When somebody's having a mental health crisis, they don't send the police. They send a mental health crisis counselor that has experience, and they send a medic, like a nurse or an EMT. And that's been proven successful. They've been having this program since 1989. I think they've taken over 20,000 calls, and they've only needed or called for police backup 150 times out of over 20,000 calls. So this is effective, and it's being researched so that it can be applied to other places like Oakland and Denver. So, and also another idea that I was hoping for that can get funded is something like Aro Village, ARO Village, that took place in Nigeria in like the 1950s. And pretty much what happened was that they needed to create a new system because they were gaining their independence. And there's this doctor named Dr. Thomas Lambo, and he created Aro Village. And it was pretty much what it was an outpatient program. Patients would come to this village with a caretaker, which could be a family member. They live with the community, and the treatment that they received was both, the typical outpatient treatment, but it also included traditional elements as well. And there was this symbiotic relationship that the community had with the hospital, because the hospital would give community members money to help them upkeep the house. And then in turn, the community members would donate back to the hospital to help with electricity or running water or things of that nature. And so what I love about Aro Village is that it did not disappear Black people. It did not throw us behind these locked psychiatric doors. It placed us closer to the community. It rooted us in our families and in homes where we were beloved. And so that's something that, I advocate for as well. These alternatives already exist, and I really want to emphasize that as well. We're not asking for anything new. We're asking for what Black people have already done to heal ourselves. And so it's possible. And I want to just give hope to a lot of people that just because you don't see it doesn't mean it doesn't exist. It does exist in some places.
Yeah. So, that was good. So 2 things I want to talk about. One, I want to get out. So prior to my last stay in a mental health facility, I actually was a member of DBSA. So DBSA is Depression, Bipolar, Schizophrenic Alliance, and they have peer support. And so there are no mental health professionals, period. Literally, like, it's people with lived experience, and it's not just You know, I always get a lot of flack for saying like the cool disorders is not just anxiety or depression. It's people who live with bipolar disorder, who are managing schizophrenia, who are managing dissociative identity disorder, and different levels of severity. And we would come together on Thursdays and we would just talk. And I mean, it felt so good to just talk. Everybody, I mean, and we would cry, we would laugh, we would joke, but everybody was able to work together as a community and really give great tools and really give great advice to, you know, this week was really crap. Like, this was horrible. I was suicidal, you know, I don't like what, and people were able to jump in and say, hey, like, well, this works for me, and this is what I tried, and you know, my therapist number is this, and that. So it was such a community, and when I got to a place where I needed help, and unfortunately, I had to go back to the same exact hospital that I had been to before, but the peer support that I got the day, literally I went the same day, it made me feel empowered. Mm-hmm. Like I felt like I was in control of my decision, and I voluntarily went. Yeah. I volunteered myself. So I think it's important, like you said, those things work. Yeah. We know how much support and communal, especially for African American people. Mm-hmm. Like I mean, that's what we do. Like we talk, we communicate, we come together. You know, we have that saying, you know, it takes a village to raise a child, but it also takes a village to support each other. Mm-hmm. And so we know that that is extremely important. And if this thing, like you said, if it works, why not do it? Why not use it? Why not put it to work? And we can actually see a change, because I feel like sometimes we're kind of talking in circles. Yeah. And it's like, well, this is the same system that we've had for thus many years, and nothing's changing. Yeah. Rates are increasing. We aren't really preventing suicide. We're working from a reactive suicidal prevention plan, which does not make any sense. We're allowing people to be martyrs. We are like, and it's like a continuous vicious cycle. And like you said, you're not asking for things to be completely different. You're saying, hey, this is a program that has worked. This is something that has been proven to work. Yes. Let's try it and see how it works. So it's interesting. But the last thing I'm gonna say, and then I'm gonna ask another question, is I think people benefit off of Black people's oppression, and they benefit off of our pain. They benefit off of our transparency. They benefit off of our struggle. It sells. It looks like, oh, we can get more money because we have more people in our hospitals, so we need more funds, and nothing works. So just a little information, guys, watching. When you go to a mental health facility, typically the psychiatrists that are there, they don't see you every day. If you're there for a 72-hour hold, you may see the psychiatrist 3 days. That's not enough time to build a relationship with anyone, not to be diagnosing you and not to be giving you medication. So that does not work. That is a part of the system that does not work. You have people who are saying, I'm on this medication and I still feel bad, yet they're forcing you and telling you you can't go home unless you take it. So that is why this work is so important. And I thank you so much, Imade, just for all the great detail. And so just kind of moving next. So if you guys see me looking to the right, I might make sure I got like everything laid out.
Take your time.
Yeah. So the next thing I know you talk about is fully funding Black mental health, the Black mental health community. So what does that look like?
Yeah, that's a good question. I think that we need to like dismantle the system. Like, see, this is my thing, right? I don't really want Black therapists to go into a failing system.
Yes.
I don't want Black slave masters. I don't want the faces of my oppressors to change, and then that's it. I don't want that. I want the system to be dismantled first. I want a patient-led peer support system. And then I want to see Black therapists in that. I want to see counselors and Black psychiatrists. But I do want to kind of make it clear that, like, I don't want more Black therapists in this current system that's oppressing me. I don't want a Black facelift. I want a whole new system. And I think what that looks like is Black folks staying in their homes, like Black folks getting treatment in their communities and not being forced to go upstate, which is what happened to me. I was in, uptown Manhattan, and I got shipped up to Westchester, New York, an hour away from where I lived. I want to be treated in my community. I want to have doctors and I want to have counselors who look like me, who taking the same medicine I'm taking. I want them to tell me what their experience is like taking medication. I want them to tell me what is it like doing dialectical behavioral therapy or generative somatics or all these different treatment modalities. I want to feel that I have my history of my ancestors with me in this treatment, that we're incorporating traditional spiritual practices as well. I want to feel that I'm home when I'm getting treated, that I am surrounded by family. I'm surrounded by people who really love me. And so that's kind of what it looks like for me. It doesn't look like this notion of beds, which is kind of what you're saying is why Black pain is so lucrative to these hospital managers and people who run them, because they know that the more people that fill these beds, the more money they make. Like, I don't want to be a bed. Like, that's what a lot of times we're reduced to, is a bed. I don't want to be reduced to a bed. I don't want to be reduced to some sort of compliant person that just takes whatever you give me. And that's kind of what you were mentioning and touching on, was like, our freedom is connected to our compliance and connected to us taking medication. And for me, I was forced on lithium and Zyprexa, which is an antipsychotic drug. And I couldn't fake taking it because I had to get a blood test and I had to get a certain level of lithium in my bloodstream in order to get out. Like, how ridiculous is that? And even when you mentioned about the 72-hour hold, I'm just like, ooh, who gets a 72-hour hold? Like, I want that. Like, because I didn't get no 72-hour hold. I was forced for 2 weeks. Let me tell you how I tried to get that 72-hour hold, right? So I, wanted to get out because it was terrible. My first time being hospitalized. And they gave me a lawyer that was assigned by the hospital. The lawyer told my mom, I'm scared to just walk on this floor.
Wow.
I sleep on that floor every night, and she's scared to just walk up to where I'm sleeping and where I have to live day in and day out. And the lawyer told me, it doesn't look like you're going to get this. I don't think you're going to get out. So the case went to a state Supreme Court judge. I'm not kid you not. They forced me to, and I know, I'm sorry, I'm diverting from the question, but I want to kind of contextualize.
No, you're fine.
That some Black folks, we don't get a 72-hour hold. We're forced in there for more than 3 days. And so, so they forced me to wear scrubs. They forced me to go there in an ambulance on a stretcher. So think about the power differential. I have a psychiatrist in work clothes that's on the stand talking about my situation. And I got into the courtroom on a stretcher in a hospital gown and hospital socks. So
stereotypical. Yeah.
Think about that. And so the psychiatrist pretty much lied on the stand and said that I would jump out of my mom's car if she drove me home. Like, literally said this. Wow. And so I do want to say also that a lot of Black folks, we don't get no 72-hour hold. We're forced in there indefinitely. And even when we try to go through these avenues, which requires a lot of privilege, I had a lot of privilege in the sense that I was, college graduate, and I would fling that around. My best friend and my mom were advocating for me. So there was so much privilege in me trying to get out using the 72-hour rule, and I didn't get it. And so, Black mental health means that I'm having such a great time in the hospital, I want to stay. Where I'm like, dang, why is my release so soon? I want to stay here. I'm having such a great time. Like, just imagine, like, what is that like, Where somebody says, it looks like, what do you think? We'll work with you. What do you think about, being released, in 2 days. And me being, I'm having such a great time. I'm making so many great friends. I'm learning so much about my healing and my growth that I don't want to leave. Just like imagine what that would be like. So yeah.
Yeah. It's wow. It's, and I think, it's so important for us to share these stories. And sometimes our experience is so undervalued as a Black person managing a mental illness. And if you guys hear me keep saying managing a mental illness, that is on purpose. I do not use the term living with a mental illness. I am just simply managing it. Managing them. I've been diagnosed with more than one. And so, yeah, like, it's interesting. And it's interesting you see the dynamic between white patients and Black patients. I worked in a hospital a few years back for a year, and I worked in the emergency room. And so I was the person who helped people get disability. That was not fun for someone who manages a mental illness. And it was really difficult for me to go in and communicate with white patients, and they would be angry and like, screw the system, and like cussing you out. And like one guy, like, excuse my language, like pooped on the floor, literally, and was like throwing fecal matter. And I was like, and they would go home. They would literally go home. Like, they would stay in like the emergency room for like 2 days and like go home. And it would be people who are African American who they have seen on a consistent rotating door, and they would be there for this one guy was there for like 4 months. That's like families, does his family know? Like, how do we do this? So it was really difficult for me, and I'm an advocate, like, at heart. And so, I had a patient who I literally got his cell phone number, and his aunt was there, and I was like, we gotta talk. Like, I gotta get him out of here. Like, he's not going to make it in here. And I was like, call me after work, and I will help you, and we will figure out a way to get him out of here. And so to me, that was so important. And he didn't have a support system. His mom was like, you're crazy. I'm not helping you. And auntie was like, I will step in. And he had lost everything. He told me, he got into an altercation with his spouse, and thus wound him up in the hospital. He was ex-military, had just gotten out, so he was dealing with a lot of things, post-traumatic stress. He did say he had recently got diagnosed, and he was struggling with the diagnosis. And he said, nobody even explained it to me. He literally told me, I don't even know what it means to have post-traumatic stress disorder. And so these are the things we're talking about. I know Imade and I both talk a lot about just educating people. It's not okay to be in a foreign environment against your will or there voluntarily. And I had to do the MMPI. So I had to take the test. That test, y'all, is like 100 questions, and it's like the same question over and over again. It's worded differently. You bubble it in, they take it down, they give you the result, and they're like, oh, you have a whole sheet of things you've never heard of. And that's how they determined my medication, and that's how they determined like what was the next process for me. No one ever explained it. Nobody ever explained to me what this test was for. Nobody explained to me the definition of any of my diagnoses. I got medication, they changed it, they tweaked it. Nobody explained it to me. So you get no explanation in these places. So when we talk about all of these great steps and layouts and plans that Imade has partnered with Beam to really try to help and fund and get started and created, this is why we're saying it's important. And I think people don't really know. And people don't really know because our stories are so valued. And so one last thing, not last thing, but one last thing I actually have typed up to remember. And so I love this part because you talk about immediately student loan forgiveness for
Yes.
all Black doctors, for all Black, like I was like, yes,
Yes.
yes, I love this. Talk to me about that. Why do you think that is so important for Black doctors, Black health professionals to have student loan forgiveness?
Because there's a school to prison pipeline that is diverting us into prison and into, low wage jobs. If we can create a school to therapy pipeline where kids in kindergarten and kids in first grade, it's normal to be a therapist. It's normal to be in that field. So what happens when you remove student loans? You're making their dreams possible, because a lot of times what happens is you could get a kid in high school saying, I want to be a doctor. I want to be a Black therapist. They may be told, you can't afford that. How are you going to afford all the education? I mean, they're already being told what they can and cannot do because of how expensive it is. And when you take that away, you're giving people ability to dream. You're giving Black therapists an ability to focus on treating their clients and not paying bills. Because a lot of times that's what it boils down to, is how many bills I got is going to determine my fee. And for a lot of therapists, a lot of Black therapists, they do want to help Black people who do not have the money, but they don't have the money to help. And I remember getting turned down once by a Black therapist that's on Twitter, but I ain't gonna name no names. Ain't gonna name no names, right? But it hurt because I see this person online talking about how they want to help Black folks, and I know they do, but they don't have the money to help poor people like me. They don't have the money to carry out their values, and it's painful, especially when you're in a crisis and you don't know what's going to happen if this therapist tells you no, I can't do it. And so when we do this, we removing student loans, we're allowing young Black kids to dream and to imagine themselves affording an education. You're allowing Black therapists to focus on what they love to do the most and not the stress of just survival. And you're helping low-income Black patients who are like me get the services they need and not get turned down in the middle of a crisis. So yeah, it's very important to remove that barrier so that people are getting funneled towards therapy and not funneled towards basically debt slavery,
Yeah. I like that you brought that up. And so I know if you guys have been watching the news for a few months, NYU has started, and a lot of big popular schools have adopted it as well. But if you go to get your MD, it can't be any specialty though. So it has to be strictly just a general MD that you will not have tuition. So it can be done. And so I'm bringing that up to say this. I don't want anyone to think, well, how do the professors get taught, and how does the school make money, and how do they keep the lights on? It can be done. And the reason NYU started doing it is because they said, we have looked at the data, rural areas that are underprivileged, minority, which I hate that term, but minority communities, minority communities are being the ones hit the hardest. So a friend of mine was getting his master's degree in biology, and he said, I was really thinking about staying there to be a doctor. He was at Troy University, and he said, but the nearest doctor's office is 51 miles away. Y'all, like, can you imagine being in a crisis? Imagine being pregnant. And saying, oh, I gotta drive 51 miles. Well, okay. Like, all right. And so that's why they started this. They said, we have to do something. We have to step in, and we have to make sure that if we are truly here to serve people, that we are creating an environment where the students who come to the school feel as though, well, if I don't have student loan debt, I may take that lower paying job in no-name Alabama.
Yeah.
Because I will be able to afford where I live.
Yes.
And so I want people to think this can be done. Yes. This is possible. this is not something. So when we start to have these conversations around defunding and asking for student loan forgiveness, I want people to know it can be done. It has been done. It will be done.
Yes.
And so we have to be vigorous, and we have to be consistent and concise, and really ask for what we are really asking for, and show like, hey, it's been like,
Yeah.
we are bringing you data. Like, we are showing you like this can be done. We're not just like grabbing it out the air and saying, let's just try something new and see if it works. And so it's important for these for this work to continue, and this work to keep going. So thank you so much for just like even including, and I didn't think about that. I honestly didn't think about, you know, student loan forgiveness. I didn't think, not for therapists, and that's or psychiatrists or psychologists or counselors, or, you know, anyone in that mental health community. I just didn't think about it. But that is a really good question. And, you know, they did a study. I forgot what school it was, so don't quote me. But they did a study, and you were like asking students like, well, why don't you want to become a psychiatrist? And they were like, I won't make any money. And the ideal is that people who have mental illnesses can't afford to go. Yeah. And it's true, because that's the truth. I mean, like I said, I worked in a hospital. This guy literally was like, I just come here because I have nowhere to sleep. Like, he was like, I literally just like do something wrong, so they'll arrest me and bring me to the hospital. He's like, and I stay here for like 30 days and then I leave. Like, and that's sad. Like, that's not serving people. That's not of the people. That's not adequate mental health care. That's not putting people first. That is not suicide prevention.
Right.
And so since we kind of brought up suicide prevention, I want to kind of touch on something. It's within the conversation. We're kind of outside of it. So I know you're really passionate about this, and I think you saw me tweet about this week. I wanted to kind of talk a little bit about privacy.
Yeah.
If you guys have been watching the news or even online, you may have seen, you know, a post going around, news articles, conversations around Tamar Braxton. And so I was really disheartened, because as someone who manages a mental illness, I understand how much that moment, I want privacy. Like, I don't want like the whole world to know.
Right.
I'm still trying to process kind of like what's going on, like what's happening. So I wanted to talk to you a little bit, because this still kind of falls into that field, especially when you're in a mental health facility. You kind of have too much privacy, because nobody kind of knows you're there. It's like they don't tell anybody. They don't let you, I mean, they kind of let you call somebody, but it's kind of like, what do I say when someone says, well, where are you? And you're like, I'm in the hospital. So, you know, I wanted to talk to you a little bit, like, what is your thought process around like privacy, and how we interact with people who may be in a mental health facility, or may not even be, may just, you know, like, talk a little bit about how do you feel about privacy when it comes to people who manage mental illnesses?
Yeah, I mean, I think it's a case-by-case basis. You know, I think people need to deserve whatever privacy they feel like is empowering for them. But yeah, I think what you're touching on is that the punitive mental hospital system weaponizes privacy by disappearing Black people and enacting cruelty upon them. And this cruelty continues because of the privacy, because we're behind locked psychiatric doors, because you can't have phones, because, you know, you can't put, I wish a patient took out a cell phone and filmed me getting physically restrained. Because I guarantee you, if that got out, there would not be doing that again. And so I do wish that in some ways, the punitive psychiatric jails and punitive mental hospitals stop weaponizing our privacy by having so much cruelty, you know, locked away behind the locked psychiatric doors. But also, I do want us as patients to have more control over our privacy, more control. This is what happened to me, right? I told my therapist, and she was actually a really great therapist, a Black therapist. when I was living in San Francisco. I told her, you know, I'm suicidal, I'm struggling. And then I took a depression nap, which is what all of us do,
Yeah,
you
it's
know?
common.
And then I took a depression nap. Because she couldn't reach me, she called the cops, and 2 police officers came to my house doing a wellness check. And one of the first things I thought about was like, are my roommates going to find out?
Oh yeah.
Because you're outing, when you call the police on someone against their will, you're outing their condition essentially. Yeah. And that was one of the first things I thought about, was like, let me get to this door before my roommates do. And then another thing that I thought about is like, God, I really hope that, you know, the person that is leasing out this place doesn't find out, because are they going to kick me out if they found out the police came here? And so stuff like that, we really need to stop doing that. Like, stop this, like, calling the police and like outing people. Like, and also like, please do not, like, please stop reporting people for like suicidal stuff against their will. Like, please, like, ask for consent first before you report to like Facebook or Twitter. Like, that's also another way of like outing them, and also possibly putting them at danger if they like call the police or do some sort of like police intervention. Like, have consensual rescue. Like, that's why I love Trans Lifeline. They do not do non-consensual active rescue. And so, yeah, I do think we need to examine the ways that helping people is basically outing them when they have not consented to that.
Yeah, that was what I mean, just well said. Like, it's, you know, I just was really thinking about that this week. I was just like, you know, we have to talk about like privacy, and we have to talk about it. And I mean, it falls along the lines of rights, but you know, and like I said, I think people, we're othered when you manage a mental illness, and so we're, because of media and because of the news outlets and radio, and when the discussion arises, often it's not people who have a lived experience, it's people who have like seen a post online, and all of a sudden they just know everything about like mental health, and they're just going off of what they saw. And people don't value kind of what our experiences are. And so, yeah, like, and I know we like live in a society now where like everything is on social media, but it's just, I don't know, it's just interesting. I'm just like, I don't even know how to like verbalize it, but it's really frustrating to see that consistently goes on, and especially for celebrities, people who are in these positions of, you know, notoriety, these people who, you know, and, you know, a lot of people comment and say, well, that's what they signed up for. And I'm like, no, the hell they didn't.
No, they didn't.
Like, they did not sign up to be invaded. Like, that is invasive. Like, you know, we saw it with Scott Disick. You know, he was in a mental health facility. He was in a rehabilitative facility, and it got out. And what did he do? He left. Now, he was privileged to leave. I just couldn't go anywhere.
I just leave. Yeah.
You know, I didn't get that luxury. But, you know, those are things that happen. Those are things that, because you don't feel safe. And we have to feel safe. I agree with you 100% about please don't call the police. They are not really trained to de-escalate. They are not social workers. They're not counselors. They're not therapists. They're not peer support group. Like, they don't have that specific training. And that's just not what they're there to do in general, in any circumstance. They're not typically there to de-escalate. And so, and we saw that happen. Was it Miami? Oh man, what was his name? I can see his face. But he was a therapist, and he went because the police were called on one of his students, and he was in the street, and nobody knew. I think he had autism, and no one knew. But he was like walking down the street talking to himself, which is not, to me, that's my normal. So I don't know. To me, I wouldn't have been like shaken up. Like, I would have been like, oh, okay, whatever. And they called the cops, and of course he didn't, just didn't respond. And I think like his mom called a therapist, and so like the therapist came and was like trying to talk to him and like, hey, like, I got this situation. Like, I am his therapist. Let me handle it. They shot him.
Wow.
He was on the ground. They literally shot him, and he was sitting on the ground
Wow.
talking to his student, talking to his child, his patient, trying to get him de-escalate the situation to
Right.
take him home. And they
Wow.
shot him. He didn't die, but the point is they still shot him. And so, just those, you put people in a hostile situation, and it really does not make the situation better. Just from my experience, I just don't feel comfortable. I don't feel safe. And these hospitals, these mental health facilities definitely don't make us, well, don't make me, I can't speak for everybody else. I just did not feel a level of safety. And I didn't, when I left, I did not even feel like I got the help I needed.
Mm-hmm.
I still felt like I don't have it all together, but I want to go home. Let me
Yeah.
just get out. It was just like it was a get out moment. Like, I just gotta go. Like
Mm-hmm.
I don't care. If you want me to take the medicine, give me the damn medicine. I'm out. Like,
Yeah, that's basically for me too. That was basically me.
so, and it's, we laugh now because we're
Yeah.
like, whoo, that was a time. But, it's really difficult. And
Yes.
so I wanted to bring up, we got a few more minutes. We got like 5 minutes. So if anybody has any questions, which I think someone did, they asked if we could go through. Oh, anybody catch the names of the alternative models that were discussed? So I think that was you, Imade. I think you were talking about the different models of treatment that were. I think you talked about DBT, and you talked about a few more
Yeah.
earlier.
Yeah. Somebody shared Arrow Village,
Oh, good. Yay.
and I think I said peer support
Mm-hmm.
respite center.
Okay. Okay, good. Yay, yay, yay. All right. So if anybody, what am I doing? Sometimes I feel like I don't know how to use like technology. I'm like, what? I'm like, what is going on? Okay.
I struggle
So if
too.
anyone, yeah, I'm like, what am I doing? So if anyone has any questions, you can definitely ask now. If there's anything you guys want to bring up yourself. If there's, it doesn't, really matter. We are here. We both have lived experiences inside of mental health facilities. So we are more. If there's a question that you just like, I gotta know, I need to know. And so we kind of talked about a little bit about our experience. And so I hope that you all kind of take away from this is that and me and Imade weren't in the same facility. I was
Right.
in Florida. Like, I was all the way in Florida. So, like, this happens worldwide. And it's not even just America. Like, it's not even just the United States. Yes, it will be available to view later. I will have it up in our the IGTV on Consciously Coping. I'm also going to share it on YouTube, my YouTube as well, and Facebook, and the Consciously Coping Facebook page. But yeah, so just I hope you guys take away from this that, one, listen to our experiences because our experiences matter. When we talk about Black Lives Matter, it's all Black lives, which includes those people who are living and managing mental illnesses. We deserve healing. We deserve support. We deserve respect. We deserve rights. And often when we are harmed, people who are managing mental illnesses, you don't really see our stories. And when you do see the stories, there is some validity behind it. Typically, the story is centered around how aggressive the person was, how the person didn't respond to verbal commands. This story is more around the person who was in distress and not the officer or the law enforcement or who was carrying out these demands, or how the situation was heightened by just their appearance or them being there. So I hope you all took away just the reason we are asking, and Imade and Beam are working so hard on this is because this really does matter to Black Lives Matter. We cannot profess that Black Lives Matter and then leave people who are managing mental illness out of the conversation. It doesn't work that way. Like, we have to be included as well. And we're also fully capable of expressing our experiences. We're fully capable of expressing our needs. We know what we need. I know what I need. That's a part of us doing the work, us, going to therapy, getting counselors and having psychiatrists. They give us those. So if you don't know, like, the whole reason you go to therapists and counselors and psychologists is to them to give you these tools so you can employ yourself and you can empower yourself so you can ask questions. They give you these tools. That's what we learn. We learn how to advocate for ourselves. And so we're fully capable of telling anyone what we need. Just because we manage a mental illness does not negate whether we can be in charge of our own lives. And so, Imade, I just, if there's anything you want to close with, I think we got about 3 minutes. So if you want to just let everyone know where they can find you, your website, social media, Beam, all of that, you can go ahead and state it again for the people who kind of just jumped in.
Yeah, and I also want to uplift the Black trans community that is disproportionately affected by suicide because of how transphobic our society is. The Okra Project is doing a mental health recovery fund for Black trans men and women. You can donate. Go to the Okra Project. They have a Nina Pop mental health recovery fund to provide free therapy for Black trans women, and the Tony McDade mental health recovery fund to provide free therapy for Black trans men. So go there and support that. I want to make sure that I'm uplifting not just myself, but other Black, led organizations. And then also, of course, you can be a part of our committee. We're trying to build a committee to dismantle systemic racism in the mental health community. So go to beam.community/Black Vision. You can sign up to be considered for this committee that we're creating. We have about 60 people so far, and Black clinicians have been amazing in their support. Thank you so much to all the Black clinicians who signed up. You can also donate at beam.community/Black Vision. And my website is depressedwhileblack.com.
Yay. So I want to say thank you to everyone who showed out. Thank you so much for your support. Thank you for being here. Thank you for all of your comments and your questions. Imade, thank you so much. I know we'll be doing something again, I'm pretty sure soon. As well, I want to shout out Jessica Jimeno. She was one of those people at the Mental Health Summit when I first met Imade. Jessica is also an awesome mental health advocate. Like, she is amazing. She does a YouTube. She has a blog called Fashionably Ill. I mean, she is awesome. So definitely check out Jessica Jimeno. I will definitely link all of her social media handles on YouTube, under this post, and IGTV. If you have any questions for her, you can definitely reach out. She's always open to answer questions and provide help and services. So you guys have a wonderful Sunday. I'm trying to hurry up before time runs out. But again, you all have a wonderful Sunday, and I will see you all at the end of this week for our conversations on Thursday that I'll be having with a psychiatrist, a Black psychiatrist, and a Black pharmacist. So we'll be talking about the medication as well as psychiatric care and what they plan on doing a part of the Black Lives Matter movement. So I'm excited. It's going to be good. They're both advocates and activists, so it's going to be good. Thank you so much, and you guys have a great night.